chat. I can talk
All right.
a little bit.
Just sit wherever here.
Yeah, you gotta have you sit there. But if you're more comfortable standing up, you're.
Oh, I did a little bit of walking. I went down to that 7-Eleven back, so I'm kind of feeling like just sitting down for a little bit.
Sounds good.
Pretty warm out there too.
So I was reading your chart. So you had a procedure back in 2022.
Yeah, so I got
Yeah.
injured back in 2020. I was a concrete worker, and then I took 9 months, finally got diagnosed, had to go to New York for the diagnosis. Finally found a surgeon willing to listen to me in Canada. Had a first procedure in 2020. Had about 2 months relief, went to physio. They pushed down on my fusion area, applied too much pressure. There wasn't enough grafting in there either, so it kind of broke that fusion. Whatever was taking place is just the lack of fusion or grafting that was placed in there, and the pressure, just the combination. That fusion broke. Ended up being told nothing's wrong with me. Had a revision surgery 9 months later in 2023, and yeah, 9 months after that I was.
And that was L5S1.
Okay, same thing. Yeah, he literally did the exact same procedure again. Didn't put grafting where it needed to be. The first procedure, he actually put a screw through the top of the L5 vertebrae right into the disc space. Like I can see the threads on a 3D image that I had made up. Like it's just a mess. And then all the screws were loose still. The joint still had mobility at the Bertolotti area, but they say nothing's wrong with me.
Did he address the Bertolottis initially?
That was the goal. Like that's why I went to him, is to like focus on that, fuse that joint so there's no motion. And he never even heard about it until I came up to him. And he had speculation, and that was the goal of the surgeries, but he didn't apply and add grafting in the areas. Basically just screws, grafting on the interlamina of the spine. Thought it was good.
So with the Bertolotti, so your initial goal was to take care of the Bertolottis.
Yeah.
Okay, but then you also probably had to have had disc degeneration.
There was very mild until after the first procedure, and then the screw went into the L4-5 disc and caused that to degenerate more. And for 9 months I said, like, I have this extreme pain in my top right side. There's nothing wrong with you. I said, are you sure? Like, and then I got 3D images of the screw, see the threads. I asked him again, even
the
up.
Bertolatti should not have required a fusion.
So some of them, there's 2 ways you can do it. I guess you can resect it.
Correct.
Which is hypothetically what I should have did, but I was talking to another surgeon in New York, and a lot of resections that were done, they didn't resect enough of the bone. Like Dr. Haines resects way more than some of these other people, and those people with the resection needed a fusion down the road anyway. So I was like, oh man, let's skip the potential second surgery and let's just fuse it off the bat. And here I am with my 3rd surgery, and all feels well right now, but it's like, why couldn't this have been done in the first time? But I really, looking back, I wish I just cut the joint out itself in the first place.
The Bertolottis?
The Bertolottis.
Just
the
resection?
Just resected the joint.
Yeah,
like
if you resect it correctly and your disc
you don't
has,
need it. Yeah.
Correct.
Yeah.
Because you want your original parts to function. If you didn't have much a fusion takes place when you get past the point of no return of disc degeneration.
Right.
So if the disc had decent disc height, I'm kind of scratching my head on why a fusion was even entertained.
Yeah, so
but it sounds like
there's a doctor in New York,
yeah.
and he primarily like suggests this just off of studies and the amount of clinical that he's done. But like looking back and then finding Dr. Haines, I'm like, man, I wish I would have like found this sooner.
Sure.
And then like you could always resect something and fuse after. You can't fuse and then resect. Like I did it ass backwards, but
yeah.
here I am now, right? Like, but I've been dealing with this for 5 years, and it's like I needed to. The government wouldn't help me. I got injured at work. WCB denied me for 3.5 years. Had to get a lawyer. They finally overturned it, but they wouldn't pay for me to come here to get the surgery. There's nobody in Canada who even like has heard about Bertolotti Syndrome.
Yeah.
So like finding somebody to help me is nearly impossible. So we've taken the chance and came up with an amount of money to come here, which was like 100 grand. But like I got 2 young kids at home. Like I'm 34 now. I'm 29 when I got injured. Like they'd rather pay me WCB and CPP disability till I'm 65 instead of just getting me better, back to work, contributing. Give those benefits to somebody else who can use it. Like it doesn't make any sense.
Also, you need to live.
Yeah, I just existed for the last 5 years. I didn't live, right?
So just what I was going to tell you before is there are limitations in how much I can discuss with you if you were in the United States. But the fact that you're outside the United States,
Yeah.
we can do a telehealth visit with no limitations.
Okay.
So when you have questions, first of all, my email is going to be available to you. And if you have questions and we can sort through questions,
Okay.
it's not going to be an official visit.
Perfect.
But if there is something that says, hey, this is a little bit more involved,
Right.
let's do a telehealth visit,
Okay.
then you can do a follow-up telehealth visit and we can connect remotely and kind of get things along or progress exercises and so forth.
Perfect. Yeah, I'm really trying to find, like, as I said, nobody in Canada knows about it, so to see somebody who's actually dealt with the condition,
Yeah.
treated other people who've had fusions or resections, whatever it may be, I'm definitely coming here. I'm not doing anything.
Yeah, so we can work with that, and then our exercise person that does a lot of exercise is Jason.
Okay.
And so we can connect as much or as little as you want.
Okay.
And progress exercises.
Perfect.
And so what we tend to do is once you get to a point where you are exercising, is you would have a visit with us remotely,
Okay.
and then make sure you're in a good place and you understand what we're looking for form-wise.
Okay.
And then you do those exercises for a few weeks, anywhere from 2 to 4 weeks,
Okay.
and then you progress. You
Okay.
say this is working, this isn't working, but you also have an open channel if you have questions
Awesome.
along the way.
Yeah, that sounds
The
good.
fact you live in Canada actually gives us a lot more flexibility
Okay.
than if you were in the United States.
Sounds
So I
good.
can't really have those conversations if you lived in Minnesota.
Crazy. Why is that?
It's just the statute that that says
Policies
that
and
my license is for the state of Virginia, and within the United States,
Mhm.
my license is whatever state I have licenses in, and
That's it,
generally
that's
is
all.
Virginia. That's my
Boundaries,
jurisdiction
right?
or my boundary for my scope of knowledge.
Okay.
They're working on improving that because in COVID they reduced that,
Right.
but now they're back on, and so like I said, we actually are able to provide more information and be more formal with people that are outside the United States.
That's
So
good
it
news
works
for
you.
me.
Yeah.
That works out really well.
So Saskatchewan, are you an Oiler fan?
I'm a Ducks fan.
Are you really?
Yeah.
How'd that happen?
I was 3 years old and Mighty Ducks came out and then the franchise started and just,
Went on?
yeah, and then it's funny because like Getzlaff, he's from Regina,
Yeah.
where I'm from, and it's just like, it's weird, but I do enjoy them. They've been pretty bad for the last handful of years,
They
but
had a good run for a little bit.
this
I love Connor McDavid. I was really hoping he was going to get it, but
yeah.
it was a good series.
Oh man, yeah,
Florida's good.
they're a tough team to beat. Like
Yeah.
Edmonton, they gave it their all. I don't know.
Yeah.
Canadian teams just don't got what it take, I guess.
I grew up outside Philadelphia, so I'm a Flyers fan.
Oh,
We
yeah.
haven't been good for a while either.
Yeah, you've been like the Ducks for a little bit.
I know, right? All right, let's get to it. So, had surgery not too long ago.
Yeah.
Was that on the
Thursday.
26th?
Thursday, yeah, the 26th.
26th?
Yeah, 4 days ago.
And you had the artificial disc at L45, correct?
Yeah, I had the
And then
disc replacement and the fusion at the L5S1.
Right, so you had the hybrid,
Yeah.
which is fusion on the bottom,
Correct.
disc on the top.
Yep.
Okay.
Yeah, you can't even get a disc replacement in Canada. It's crazy.
To be honest, it's still considered experimental here. Like insurance,
Yeah.
if you were an American citizen and had private insurance, you wouldn't have it covered. The fusion might be covered, but the artificial disc and the hybrid would not be covered. The fusion component might be covered.
But it's still been like 20 years they've been doing stuff like that. Like it's
Insurance
crazy.
companies just call everything experimental until they're forced to say otherwise.
Yeah, they don't want to approve.
Because you can find research that supports it, and you have surgeons out there like the surgeon you had that didn't do such a great job.
Yeah.
He's going to be a part of a research study that says that these
Didn't work.
procedures don't work.
Yeah.
And so the insurance is going to hang their hat on that.
Yeah, it's crazy.
What were your symptoms before surgery?
Oh, I was almost bedridden. Like I'd get up, I could walk to go to the grocery store to grab
Back,
a couple
leg?
things. It was primarily back, lower left, down to my buttock, around my hip. When it got really inflamed, that pain would go down my leg, not to my knee, about halfway to my knee. I'd also experienced pain on my lower right side. That was because of the loose hardware that was in my back as well, which I was told there's no issues with by all the Canadian. I've seen 10 surgeons in Canada, and they say nothing is wrong with you. You're fully fused, the screws are intact. Like, and then Dr. Haines sends me a video like outlining, and also another doctor in New York says the same thing that Dr. Haines is saying. Like, this is what's wrong with you, but I cannot find anybody in Canada to like.
So how are you doing now?
To be honest, like I feel really good other than the surgical pain.
Okay.
Like I have the incision pain in the front, swollen, tender, and then also in the back, a little bit of right-sided pain. It could be nerve or muscles or just when they decorticated the bones and stuff like that, but it just surgical.
So anterior abdominal pain, and then where else did you say?
My back right, where they also removed the hardware, so they were working back there as well.
Okay. On a scale of 0 to 10, what is your discomfort level?
6.
On both places?
Yeah, I would say just on average.
What are you doing on a daily basis to help your discomfort? Are you icing? Are you?
Yeah, so I ice. I'm taking medication every about 6 to 8 hours.
Okay.
And then just lots of rest, laying down. But I do get up every hour, so go for a 5-10 minute walk or whatever, trying to stay mobile so I don't see just the typical stuff that they suggest to do after surgery.
So BLTs, as you know, bending, lifting, twisting restrictions.
No go.
We say we want you to be as mobile as possible that's reasonable.
Right.
So BLTs, we call it conversational movements. Hey, how are you doing? But you're not going to your end range.
Right.
You're not doing anything that's uncomfortable. But, bending a little bit is okay. Looking at putting stuff up in a cabinet is okay for extension.
I've been doing all that.
So conversational movements within a comfortable range are totally okay.
Right.
I recommend slow and controlled movements so you're not getting yourself in trouble before you realize you're there. You've kind of already been through this a little bit.
Yeah.
So BLTs are not an absolute, but there just need to be reasonable movements overall.
Yeah, so I haven't had anybody come down. We had some issues with miscarriage and complications with that. So I've been down here alone. So I've been in a hotel. I've had a home care nurse come and check in on me, but I've showered. I've been cooking on my own. I barbecued at the hotel.
Nice.
So I'm doing
things.
a lot of and I with caution, right? I know what my limitations are when I go in the bed or try to get up. There is tightness here and the normal kind of stuff that you're going to deal with after this. But
in the past and currently, are you doing any scar mobilizations? Do you know what those are?
No, I don't.
Okay, I'll work through those with you a
Okay.
little bit to make sure you know that. Are you doing any nerve glides?
Don't know what that is.
Okay, so we'll work through that a little bit as
All
well.
right.
So the first part of your rehab is going to be to do things that are going to help with mobility.
Okay.
You want to walk as much as you can that feels good.
Okay.
Find out if you can walk for 10 minutes and feel good doing 10 minutes, that's perfect. If you walk for 15 and you feel uncomfortable and painful, bring it back.
Okay.
So challenge yourself a little bit, find out where your limits are, and then work within that framework for about, I'd say 8 repetitions. So go for 8 walks at the same amount, and then you can try to bump it up a little bit.
Okay. Would that be daily then, kind of 8 walks a day?
I would like you to walk not 8 walks a day, that's a lot,
Okay.
but I'd like you to get to the point where you're walking for an hour.
Okay.
So if you're walking for 10 minutes, then that will be 6 short walks.
Okay.
That will help you quite a bit. Do you have access to a pool?
I do actually, yeah.
So getting in a pool and walking at chest depth,
That's what I did the previous.
once your incision is healed and closed, get in the pool and just work on mobility. Walking forward and backward, walking sidestepping, doing things where you're just doing marching in place.
Exactly, yeah.
So all those things are going to be good on the early, and just going to help promote mobility and stamina. That's going to be helpful as well.
Perfect.
Also getting in there for 30, 45, 60 minutes, overall. If you have access to a kickboard, you can take a kickboard and you can stand and then you can push back and forth. You can hold it this way and you can roll it and go back and forth. Within the rotational limits, you're not going to go all the way to end range.
Strengthen the core.
Strengthen the core. And then you go from standing on 2 legs, that same movement, you might do 15 repetitions of each of those movements. And I'd also have you push the kickboard down and back.
Okay.
Some people have aquatic dumbbells, which are like styrofoam and they float.
Right.
If you have those, great. If you don't have those, there's no need to get them. You use your kickboard. So those things are going to help you, and then you do that same thing standing on 2 legs, then you stand on 1 leg, and it's a little bit more challenging. When you're in chest deep water, you're only weighted about 20% of your body weight. which should feel pretty good. If the water is a little bit on the warmer side, then that's great. If it's cold, it actually will help with some of the inflammation as well.
Okay.
So either or, it kind of has a benefit overall. But we want to help promote mobility and get you moving a little bit better. That's the first step.
Okay.
The second step is to give you some exercises that we call that are neutral spine. And so we're going to check a couple things out. We're going to give you some nerve glides.
Okay.
You know, you've just taken 2 segments of your spine, revised L5S1, but you also have the artificial disc, which is L4-5.
Right.
So we've actually put a little bit more tension on the neural structures, the nerve structures that are in that area.
Okay.
And so we're going to make sure that you feel loose. I'm going to encourage you not to overstretch. So when you stretch, we want to not hold the stretch for very long. We're going to do oscillating movements. Nerves do not like to be held in a stretch.
Okay.
They will actually, the muscles will clamp down around the nerve. So if you're somebody that used to stretch your hamstrings and your hamstring length wouldn't change, you know, until you're blue in your face, you're stretching and stretching and stretching.
Yeah.
It's because the nerves were irritated or not responding, and then holding that stretch actually makes that worse.
Okay.
So we're not going to stretch and hold stretches initially, and you're not going to stretch aggressively in your back or in your legs.
Right.
And then we'll talk about that a little bit. So we're going to do oscillating. You're going to kiss the tightness and then come right out of it. Kiss the tightness, and you're going to oscillate for about 20 repetitions, and you're going to do both sides.
Okay.
And then I'll show you how to do that as well.
Awesome.
Yeah. Any issues with bowel and bladder function? Are you having much leg pain at the moment? You said
No,
mostly
like-
low back pain?
Yeah, it's primarily just lower back pain. I mean, my legs are a little sore just from like the walking that I did today, but nothing post-surgical.
Yeah.
Just
Not numbness and tingling?
No, just some soreness just
Okay.
from using them.
Does coughing or sneezing bother you?
Just the stomach a little bit, like
Okay, but
that
not the
incision
back or
area.
leg?
No.
What questions do you have? We're going to go through some things, but do you have any initial questions? Or do you want to wait till the end and see if we covered some
Yeah,
things?
let's just wait till the end. I don't know, like, probably think of something as we go, but just
Okay.
trying to take in all the information as we can.
Let's do this. Since you have your phone there, let's have you sit here facing that way.
Do you want the back brace on or off?
You're going to have to take it off. So Regina, Saskatchewan, where exactly is that?
So we're bottom. We're just under, I think it's North Dakota.
Okay.
Or Montana. I don't know, I'm so.
So you
bad
have-
with states.
you
We're the
have
lower.
British Columbia, then Alberta, and then the Saskatchewan.
That's Saskatchewan. We're right at the bottom right.
So Saskatchewan is
And then there's,
east of Alberta?
yes.
Okay.
And then there's Manitoba beside us.
Right. Can I have a seat? It's funny, when we were on our honeymoon, we were at a bar at the Banff Springs Hotel, which is a beautiful hotel. And,
Yeah.
we were really fortunate because the exchange rate was really favorable for us. We got married 26 years ago.
Yeah, coming here, it wasn't nice for me.
Right? Yeah, but the bartender was all over us. He's like, name all the provinces of the, territories of
Yeah.
Canada. And
Good luck.
we got through maybe 8
Yeah.
or so.
Oh, that's pretty good.
Yeah. I mean, to be honest, I think the reason I know them mostly is because of the board game Risk.
Okay.
I'm not sure if you've ever played that
No.
game, but it has a lot of those areas of
Yeah.
territories. But what do you got? British Columbia, you got Saskatchewan, you have
Yeah, you
Alberta,
got Columbia,
Manitoba,
Nebraska.
Northwest Territory, Prince Edward Island. Is that correct?
Yeah.
Quebec. Halifax is a city.
Yeah.
Is Ontario?
Ontario's one, yeah.
I don't know. I haven't done.
New Brunswick.
Yeah, that's on the East Coast.
Yeah.
Right?
And then there's Nova Scotia.
Yeah, the East Coast as well.
I think that's it.
That's it. All right, it's not bad.
Pretty good.
All right, what comes up? Good. Weight comes up off the table. 20%. How are your boys?
I got 2 little girls.
Oh, girls. There you
Yeah,
go.
6 and 9.
you're in it.
Yeah, wow. They were
Really push you
they
back.
were 2 and 4 when I got hurt, so I've been kind of just missing out on a lot. You know, that's the ages where you really want to try to be as active as I can, but it's a lot, man. When you got bones rubbing in your spine, you're really limited to what you can do, but you try to be there for them anyway.
Yeah, I have twin daughters. I have a son who's 21 and twin daughters that are 16.
Oh yeah, you're right in it, eh?
Okay, hands behind your back, and you're just going to let yourself kind of slump down. Does that aggravate your back at all? No. Okay, and come back out of that. Okay, so we're going to talk about nerve glides in this position. So nerve glides are a technique to get your nerves to slide and glide better.
Okay.
Nerves do not stretch like muscles. Do you remember the toy, the Chinese finger cuffs?
Yeah, yeah.
Well, that's exactly what happens. When nerves slide in a tube, so if those tubes get pulled on, it just compresses on the nerves.
Okay.
The nerves have significant blood vessels around them that give it its nourishment, and what goes along with blood vessels is pain receptors.
Okay.
And so when those get compressed or stretched more than they like, then your muscles clamp down around that area to kind of try to protect that area.
Okay.
So what we want to do is we want to do what are called nerve glides. Sometimes they're called flossing.
Okay.
So what you're going to do, sitting here, you're just going to sit up nice and tall. You're going to straighten your leg out with a loose ankle until you feel a little bit of a stretch.
Okay.
Okay, when you feel a little bit of
Probably
stretch,
right.
then you come right out of it, then you want to kick out. And if it's a dotted line, as soon as you cross that dotted line, it's a stretch. As soon as you come out of that dotted line, you don't have to come all the way back.
Okay.
And you're going to do this about 15 to 20 times.
Okay.
And then you're going to do it on the other side. Does one side feel tighter than the other?
I think the right side was a little tighter, but I think I'm sitting a little.
Yeah, you can arrange yourself any way you want. So the starting point is you're going to sit relatively upright.
Okay.
Okay, because of the low back, another way you can do this is you can slump down. When you get into what's called a C shape, it's going to put the most tension on the neural structures. I don't want you to actually put your back in that position. So you're going to sit tall, and on the tension you're going to get is from the legs.
Okay.
Now you can get that to be, when that starts to feel pretty good and you get pretty close to full extension, then what you can do is you can actually pull your ankle up, hold that, and now straighten out. You're going to catch that tightness earlier.
Yeah.
And you're gonna go until you feel some tightness, and you're just gonna come back and forth. Again, you're gonna do this about 15 to 20 times.
Okay.
And you're gonna do this 3 times on each side.
Okay.
So you can do this, you don't have to wait until you can get full extension with a loose ankle.
Okay.
I would prime the system a little bit by having your ankle loose.
And jump into this.
And then you can do a couple, maybe instead of doing 3 sets of 20, maybe you can do 4 sets of 20, 2 with a loose ankle, and then 2 with your ankle pulled
Okay.
back.
And once a day?
Start with once a day.
Okay.
Nerve tension will connect with the low back as well.
Okay.
And if you overdo this, it can really light this up. So
Okay.
I want you to be very gentle, just kiss the tightness and then come out of it.
Right.
And then just see what we call it as like an audit day, where then the next day you kind of don't do them and see how you feel.
Okay.
And if you feel flared up a little bit, then one of the things you might have done was overstretch this. Because you look like you're somewhat athletic, and with respect to that, some people just are doers, they get after it.
Yeah, that's.
And so more is not better.
Less is more. Here.
Less is more for the nerve glides.
All right.
Yeah. Let me have you lay on your back. Knees can stay bent. Okay, I'm gonna have you untuck your shirt so we can get to your incision. Okay, so the incision's still pretty fresh.
Yeah.
Okay, so what you wanna do is if the line between my fingers is your incision, you're gonna take your fingers and you're gonna kind of work above, on one side, right and left sides of it,
Okay.
and you're just gonna loosen it up. Now you do not want to do that very aggressive. When it's closed and healed, you can get a little bit more aggressive and you can press down
Okay.
a little bit more, but you do not want to open up the incision.
Yeah.
Okay?
Okay.
So with respect to that, get some sanitizer. So with respect to that, you can start, if you press into the incision, you can feel, you know, what they've done is they've gone in deep,
Yeah.
you know, and that tissue can connect to things, and it kind of gets sticky. Just like a cut that you have, it has, the blood clotting in our body is fibrin, and the fibrin makes this lattice, what the blood does. And so when you open somebody up, that fibrin is present, you know, as part of the blood that's from that incision, and that fibrin just can get sticky.
Okay.
And so we want to make sure that things are sticking together the way they should, but things are not sticking that shouldn't be sticking.
Okay.
So what you can do is you can start off away from the incision, and you can just stop going up on your right side and down on your left, and then you can switch.
So you go like this?
Yes, but I'm pressing down.
Yeah.
And then
I feel that.
Yeah. Okay.
Okay.
And then what you can do is you can do the same thing, but sideways.
Okay.
So I'm going to have you try that, very gentle. So thumbs are going to be next to each other, and then one's going to go, they're going to go in opposite directions, just nice and easy. And you can even use your fingers if you want. So that looks pretty superficial. I'm going to hold your hands here. So what I want you to do is you don't have to be on the incision. Come down in through the tissue. You can even go up and down. So you can kind of do that. And what I would say if you're watching TV or in bed,
Just play with it a bit.
just a little bit, just a couple minutes.
Okay.
You know, every day, spend a little time on the incision, and just like you can feel how loose our skin is, you want that incision to slide.
Okay.
And you want to make sure, you know, it's not getting kind of caught. And if it is caught, once this heals a little bit, you kind of get after it a little bit more. You work it a little bit more. But you want to make sure it heals over the next 2 weeks.
Right.
Yeah.
So when do I start that? Like start it
Now.
Right? Just keep
Now.
going at it?
Yeah.
Okay.
Yeah, you know, just a little bit of pressure through the subcutaneous tissue.
Okay.
And then you kind of work it a little bit.
Okay.
But you're not
Ripping. You're just gliding around.
down and maybe moving maybe an inch.
Okay.
And just working through that.
Sounds good.
Might be a little uncomfortable. It's probably going to feel weird more than anything.
Yeah.
Because it's kind of sensitive.
Yeah, it's pretty tender in there still.
Yeah.
Yeah. But no, I can manage that.
Yeah. So that would be helpful to do that.
Okay.
So we did nerve glides with you sitting.
Okay.
Now you're going to do nerve glides laying down.
All
so
right.
you can bring your shirt down. Okay, so your leg's going to come up, just the one leg. You're going to hold the back of your leg with both hands. You're going to have both hands. You okay with that?
Yeah.
Where do you feel that?
Just my lower back is.
Okay. Can you bring your knee up?
Yeah. Well, yeah, and in this incision area, it's a lot of pressure right there.
Okay. So what you're going to do is you're just going to, with a loose ankle, you're just going to go up until you feel a stretch.
Okay.
So you show me where you start to feel a stretch.
Probably there.
Okay. Again, 15, 20 times. If you do it sitting up, you don't have to do it laying down in that same day.
Okay.
This is an option for you.
Just one or the other.
Yeah.
Okay.
If you have time, you can do twice a day, but I wouldn't do them back to back. I would do one in the morning, maybe one in the afternoon or
Okay.
evening. Okay. Same thing. Let's try this side. Again, you're going to do this about 15, 20 repetitions and roughly do it 3 times on each side.
Okay.
Light stretch is the most you want to feel. You don't have many leg symptoms right now, so this is really effective for people that have leg symptoms, but it does help
get everything
moving a little
Okay.
bit better. I'm just going to have you do it one more time, but this time I'm going to have you pull your ankle back.
Okay.
Okay, you're gonna pull your ankle back, hold that, you're not gonna go as far.
Oh yeah, I can feel that weight.
Yeah.
Same idea as earlier, just on my
Correct.
back, yeah.
This is just a different, some people find one more beneficial than the other. So instead of doing hamstring stretches in the back of the leg, you're gonna do nerve glides
Okay.
for the next several weeks.
Yeah.
Okay. Okay. This leg's gonna straighten out. You're gonna do a stretch to your gluteal area.
Okay.
This heel is gonna come and rest on that leg. Okay, good, perfect. This hand is gonna reach up and kind of pull the leg in a diagonal manner. Diagonal. Do you feel a stretch back here?
Yeah.
Yeah. Again, you're not going to hold, you're not going to go super aggressive with this.
Yeah.
It's just going to be a light to moderate stretch.
Yeah, I don't think I have to go like. I
Hold
feel
the
like
stretch
that.
for a couple seconds and then just let it out a little bit. And then you're going to do that.
Yeah, I feel it like instantly.
So some people feel it at a diagonal, some people feel it directly across their body.
Like I feel it just as soon as my fingers like.
Yeah, and some people you need to go up towards their shoulder. So mess with the angle
Yeah.
and figure out where it feels the tightest, and you can work in that range.
I can literally just
Yeah.
bend my fingertips and I'm feeling it down in here
Yeah.
already.
Okay. This is not so much of a nerve glide, this is more of a muscle stretch.
Okay.
But I would encourage you to not hold it for very long. I would say hold your stretches 5-10 seconds
Okay.
in the beginning. And this heel can go there. Feel it there as well.
Sit in the front here.
What's that?
Yeah. I don't know.
What kind of exercises have you done in the past for your back?
So I was doing lots of leg and core stuff.
What were you doing for core?
So I haven't really done anything for quite a while.
Okay.
Like anytime I would do something, I would just get so inflamed that I would just be in a bed for like a couple days or a week. So I just stopped doing like everything.
So the exercises that we would take you through if you were local is neutral spine exercises.
Okay.
You're hot off the press from your surgery, so
Yeah.
I'm gonna explore these with you and
Okay.
see what will work and what won't work.
Okay.
And if you're not ready for it, then we'll hold and we'll
Okay.
connect in a few weeks and kind of progress some things.
Sure.
So I'm gonna have you, when you're ready, I'm gonna have you roll to your side.
Okay. This
Have
way.
you ever done side planks before?
I think so. One leg up and
No.
no.
So side planks is you're gonna be laying on your side.
Okay.
You're gonna be propped up on your elbow, and you either have contact with,
Space here.
yes.
Okay, yeah.
So it's either gonna be from your knees,
Yeah.
which is gonna be easier, or all the way down your feet.
Okay.
So I'm gonna recommend your knees to start.
Yeah.
So I'm gonna have you roll to your side.
This way or that way?
Doesn't matter.
I might go left here.
So when you roll, I'm gonna have you draw in your core a little bit, kind of suck in your stomach. Does that help you at all?
Yeah, that's.
What you do?
Yeah.
Okay. Okay, so your knees, your legs are gonna stay exactly the way they are now. I'm gonna bring them back a little bit.
Okay.
Okay? Now your elbow is gonna be underneath you. So right now your arm is here. Your elbow is gonna come directly underneath your shoulder.
I gotta move my knees.
Yeah, yeah,
just
yeah,
to
yeah,
get
yeah.
position.
Okay. Okay, so what you're gonna do is, if you can, and you can use this hand to help you up, is you're gonna lift up, okay, and you're gonna hold that for 5 seconds,
I just feel it in the stomach, just like
okay?
quite a bit of pulling right at that incision.
Okay? So if you can't hold for 5, hold for less. And then eventually work up to 5 seconds.
Okay.
So you might actually just come off the table
A second.
and then come back down. That might be where you start.
And then 5 is where you kind of want to be.
Probably 10.
15.
So what you do is you shoot for 5.
Okay.
If 5's not good, then you regress to 2 or 3 seconds. If that's not good, then you just come up, pause, and come back down. Once
Is
you
it
get,
okay to use this to like?
yep. Yeah, you're gonna push into your legs and into your shin to lift you up.
Yeah.
Now, ideally, right now you have a little bit of a bend here in your hip. Ideally, don't do it yet. But ideally, I want you to be, these are side planks, they're called planks, like a plank of wood.
Right.
You want to be straight. But I think if you come forward, you're going to feel more in your...
Yeah, I don't want to pull much more at the moment.
Yeah. So just so you know, as you get better, these hips, as you come up, you're going to pull forward.
Okay.
So you're a straight line between your knees, your
Right.
hips, and your shoulder.
Okay.
Okay? So that's the side plank. You do this on your right and your left side. I would probably start off with holding for a second or two.
Okay.
If you can't do that, then just come up and pause. Then work to 5-second holds.
Okay.
And then you're going to do 3 sets.
Okay.
3 sets of 5
Perfect.
seconds.
Okay.
Okay? I'm going to have you on your hands and knees.
Okay.
Do you feel like you would feel better with your brace?
Oh yeah, that thing definitely hugs you more. But
Right.
I'm here now.
Let's do it.
Put it on?
Yeah. So in the first couple weeks, you can use your brace to do these exercises.
Okay.
And then when you start feeling stronger, you wean yourself off the brace. Even better.
Yeah.
Okay. So what we're going to do next is what's called a bird dog exercise.
Okay.
So the bird dog exercise is you're going to be on your hands and knees, and then you're going to reach out, ideally with one leg and the opposite
Yeah.
arm. Okay? And what this is doing is, first you want to be in neutral spine, and we'll talk about what that means.
Okay.
And then we're going to have you reach long with your hand and your foot. If you can't do arm and foot at the same time, then you're just going to do the arm, and you're just going to do the leg. If you can't do that yet, then you'll work into that over the next couple of weeks.
Okay.
Okay? But it's okay to use your brace for these exercises
Okay.
on the short term. Okay. So neutral spine, hold on a second. Neutral spine would be, if I put a ball here,
Mm-hmm.
small ball, it should stay put.
Okay.
So, yes, good. So let's go ahead and straighten out. When you push your right leg is gonna reach out like it's trying to push the wall behind you.
Okay.
You okay with that?
Yeah.
Okay, and then come back. Okay? It's not about just kicking out and just going out loosely. Like, you want to feel like if you had a wall and your leg was pushing on that wall, then it's sliding that wall away.
Okay.
Hands, same thing. You can make a fist and you're going to try to pretend like you have a pretend wall that you're trying to move further away from your body.
Okay. And same time?
Let's do the hand by itself. And you want to reach long but maintain your balance. Good. Okay, you're okay?
Yeah.
Okay. Now if you can, try the leg and the arm together. Okay. Holding for 5 seconds if you
Hold.
can. And then come back. If you can't hold for 5, you just hold for a few seconds. If you can't hold for a few seconds, you go out and pause and come right back.
Okay.
So let's do 5 in a row. How are you feeling?
Not bad.
I would have you come back and kind of reset.
Go down?
Yes.
Okay.
And go.
I don't think I want to overdo it yet.
Yep. Okay, so that's exercise number 2.
Okay.
Okay. The third exercise is prone planks, but I think I'm going to have you hold on that.
Okay.
Prone planks would be on your stomach, and then you prop yourself up on your elbows.
Just a regular
plank. Yeah,
Okay.
plank. Yeah, you can go ahead and sit on up.
Okay.
So 3 sets of 5 for 5-second holds is your initial goal.
Okay.
Do you have the ability to come down, or dose up?
Okay.
Based on how you feel. Don't overdo it.
Right.
Stay with what works for about 2 weeks.
Okay.
Like what I like to do is you have to get your body conditioned to the exercise. So a runner is not going to increase their mileage, every day.
Right.
So usually I have them over a 2-week period, which is roughly going to be 8 sessions, that you stay consistent with what you're doing for 8 sessions.
Okay.
And then after that, then you try to progress.
Okay.
So find out what works, where your point is for each of those exercises.
Okay.
And right now you have nerve glides, you have the glute piriformis stretch, side planks, and you have bird dogs.
Okay.
So that would be your regimen for the time being.
Okay.
And you're not going to overstretch.
Right.
And you're going to walk. You're also going to walk as a part of that.
Okay.
Yeah. So that's what I would start with for you overall.
Okay.
If you were coming here more frequently, we would work on soft tissue, we work on your thoracic spine, we work on those things, and maybe we can connect you. I mean, Canada has, I was trained by Canadian therapists.
Okay.
There's some really good Canadian orthopedic physical therapists that we could potentially connect you with.
Yeah, if you have somebody you could refer, or you can say this guy or girl is.
What I'll need to do, I'll have to reach out to my network. The people that I train with are a little bit more British Columbia, Alberta.
Okay.
Like Abbotsford and Vancouver.
Yeah, that's pretty far.
Yeah, so I'm not asking for you to go there, but what I'll do is I'll ask them. They were pretty involved with the Canadian orthopedic.
Okay. They might have somebody.
Yeah, what we try to do is use our network to find people close to you.
Right.
Yeah.
Yeah.
So,
yeah, and if not, I have no problem doing video stuff.
Yeah.
It might be a little more difficult, but
Well, exercise, we can't do the hands-on stuff remotely, but we definitely can give you the exercise progression.
Yeah, that sounds good. We'll figure that out. So you think do this for the next 2 to 3 weeks, check in again and see where I'm at, and then.
I would have you do these exercises until you can do 5 repetitions of 5-second holds for these exercises plus the prone planks.
Okay.
And when you get to that point, your incision should be a lot better. That might be 2, 3, or 4 weeks.
Okay.
And then when you get to that point, usually our schedule fills up about 2 weeks in advance.
Okay.
So you might want to just call and say, hey, we want to do a virtual visit. Yeah.
Okay.
And if you're not ready, just give us 24 hours notice. Just say, I thought I was ready, but I'm not. I want to push it out a week or 2.
Okay.
And go from there.
That sounds good. What is another fault? This one I think was 220. Is it the same for everyone?
Yeah.
Okay.
Yeah.
Yeah. Yeah, whatever it is, what it is.
Well, so you don't have to make a formal visit for just questions.
Right.
Shoot me an email, and I'll answer as much as I can.
It's the whole new plan.
And it's just a matter of when we're going to take an hour or so to really revise some things and work on one form that we need to have a video, then I'd recommend a formal visit for that.
Okay, yeah, that's fine.
But for questions to say, hey, I'm having some discomfort, if anyone, try to identify one exercise, if you're having a flare and you think it's related to your exercises.
Okay.
Take one exercise out at a time and try to identify what exercise is the problem.
Okay.
And then you continue doing all the good exercises, and we hold on the exercise.
Bring that one in.
Correct.
Okay.
It just means either your form's not correct, or you're just not ready for it.
Okay.
And just we'll bring you along in that regard.
Awesome.
Yeah. So it's just a matter. We want to keep you in neutral spine because we're not flexing, extending, bending the spine. Let that heal.
Okay.
But start to get it stronger wear your brace on your walks, wear your brace while you're doing exercise until you start feeling stronger.
Right.
And then you start weaning off it.
Yeah, there's something about this that makes you feel much more secure.
Well, it does. It
hugs
does.
you and keeps everything
It
in
does
control.
give you support, and what it does is it actually gives your body kinesthetic feedback that actually it turns on some muscles differently,
Mhm.
and also turns off some muscles that haven't been firing or have been firing too much.
Yeah.
Yeah.
Not good to rely on it all the time though, because then those ones that are kicking out will kick out for too long, and then.
Not right now. Don't worry about that right now.
Okay.
So so there's a lot of discussions about braces being bad.
Okay.
Braces are very helpful with new injuries and helping to protect, and it actually gives you feedback on your skin that actually helps turn on muscles correctly.
Okay.
But where braces are bad is if you use it as a long-term crutch.
Right.
So as long as you're doing exercises to get stronger, the brace is fine. But you should not be wearing the brace 3, 4, 5 months from now.
And don't be reliant on it.
Correct.
Okay.
As long as you're working towards getting stronger,
Mhm.
the brace is great. Because
Okay.
there will be a time that says, I do feel better with my brace, when I'm doing X, Y, Z, when I'm doing my exercises or when I'm doing those things. It has a benefit.
Right.
It's not an all or nothing,
Okay.
but it's a bridge to help get you there, and then when you're there, you put it in the closet.
Yeah, that all makes sense.
Yeah.
Okay.
There's a lot of people out there that say don't use braces.
Yeah, you hear it all.
Braces
both
are very
sides.
helpful in this interim period.
Okay. Yeah, like I wasn't wearing it, but I knew like yesterday I had to go for a car ride to the pharmacy, so I threw it on. And then go to VSI today, I threw it on. Airplane ride, I'll throw it on.
Where-
like
where
around
is-
the house, I don't think I will and stuff like that.
You decide.
Yeah.
If you feel like it helps you, don't throw it out too soon.
Yeah.
But because you don't want to get yourself in a situation and overdo,
Yeah.
and you're like, oh, I'm really flared up. Wear it to help protect you. And I think if you do these exercises consistently over the next couple weeks,
Mhm.
you'll feel better. You'll start to not wear it around your house. You'll be like, I feel pretty good.
Yeah.
You start exploring with less brace,
Right.
and then you naturally it's like medication.
Yeah.
When you feel better, you stop, you forget your medicine,
Wear
and like,
off.
oh, I don't need it as much.
Right.
Do you have questions for me? Would you like a handout with these exercises?
If you do have one, I think that would be helpful. Yeah, then I can look at it. Like I have the video here to go back and
Yeah.
see how they're doing. But yeah, if you have a little handout that says exactly what ones and then the repetitions or whatever
Yeah.
it is, if you could print that out, that would be sweet.
Sounds good. I will go ahead. I'll meet you out in the lobby.
All right.
And then, do you have any questions at all?
I don't think so.
I'll
It's
give you my
kinda-
card as well. So email is the easiest way to get in touch with
Okay.
me.
Awesome.
And then if we need to do beyond that, or when you can always call us to schedule a follow-up session.
Okay.
When you're ready for that.
Right on. So just start these today.
Yeah.
Carry them on. Take it easy. And once I feel like I can progress, just do a little
Yeah.
more, and then
No exercise that we did today should make you feel worse.
perfect.
And so if you start feeling worse, you got to figure out which one,
it is.
and you got to think about, did I overdo that?
Yeah.
Yeah. So just listen to your body,
Okay.
and you're gonna feel a ton better over the next couple weeks.
I sure hope so.
Yeah.
Yeah, the physio I did back in Canada was not like this at all. Like,
Yeah.
it was, get me in, this is it, and you're on the road. But yeah.
Yeah.